Today we will be taking up depression and the heart. I think this is a very, very important topic because many of us don't quite realize how much emotions, most especially depression, can affect the hearts of our patients. So let me start out with the first question, Doctora. What is the rate of depression?
Um, Depression is a very prevalent psychiatric illness. As a matter of fact, it is now an upcoming rater in terms of the WHO global burden of illness. It is now number 4 globally. It used to be number 6, now it's number 4. In 2020, they're thinking that it might go up to second in line. So this is something that we should be all concerned about because in medical illnesses, it also is an accompanying comorbidity. As a matter of fact, for heart attack, it's 40 to 65% of those patients will experience depression in one time or another. And the highest risk of depressive symptoms usually occur within the first 2 years, and while these symptoms diminish, patients with heart disease maintain a significantly higher risk for depression for as long as 8 years after diagnosis. So this is quite a concern not only for the patients and family members, but also for the accompanying physicians treating patients with heart disease and other chronic illnesses.
Now that you mentioned that, Doctora, why is it common to see depression in heart disease, in cancer, or other chronic conditions?
The physical limitations imposed by heart disease and other chronic illnesses, such as arthritis and lung diseases, are also common source of depression, particularly among older adults. Prolonged untreated depression in patients with cardiovascular disease is a known contributor to subsequent heart disease, heart attacks and strokes, because depression can psychologically intensify the pain, anxiety and tension, fatigue and disruption in the usual routines and social life. The sluggishness, the low energy, the unexplained and unreasonable tiredness and social withdrawal, and the disturbance in sleep, even oversleeping, associated with the signs and symptoms of depression, aggravates the severity of the chronic illness.
So what you're basically saying is that depression can have an effect on the disease, and the disease can have an effect in depression.
Yes, it's really a very close interaction.
As you were saying a while ago, let me just emphasize. A lot of patients who would have, like for example, heart disease or cancer or chronic illnesses may have a depression which actually stems out of their own disease. Okay, it's not necessarily the one that precedes, but it is a result of the disease condition. And as we said, and as Doctora mentioned earlier, this could be because of their limitation, of their loss of freedom, of their part of the effects of the medications, and maybe some other causes. On the other hand, also the depression per se can also cause or even magnify or worsen the disease process that is going on. Is that correct?
Yes, so it's both biological and also the psychosocial aspects of the person. So we don't only talk of the person as a carrier of a disease entity, but also as a human being. In every medical illness, there's also the psychosocial aspect and even the spiritual. So these are also some of the causes that aggravate the illness.